A lot of people with low back pain, sciatic pain, SI joint pain, and so forth are led to believe that lack of core strength is one of the major reasons why they have these conditions. But in my experience, this is not the case. As a physical therapist, I rarely ever prescribe core strengthening exercises. This is because I found that there are larger influencers on back pain, sciatic pain, SI joint pain, and so forth than the core. It's not to say that the core has no place in back rehabilitation, but I have found in terms of chronic back pain that they are overly emphasized and not useful. And one of the reasons I came to that conclusion was graduating from PT school. Of course, we're taught all about core training, core stability, all sorts of things, and that helped pretty much none of my back pain or sciatic pain patients. What I have found to be a larger influencer in these cases are biomechanics. So what we're going to talk about today is the myth of core strengthening as a primary tool to use in solving chronic back pain. Now, I want to say right up front that I'm not talking about acute back pain that has just recently happened. Core strengthening may be more helpful in these situations. What I think is going on with this observation is that a lot of more significant acute back pain is a disc-related type of back pain. And disc-related types of acute back pain, I think, respond relatively well to core strengthening because you need to stabilize the spine in order for it not to pinch the discs that are irritated or inflamed, bulged, herniated, and so forth. However, as those acute disc issues resolve, core strengthening, I think, becomes less and less important. So here's a person that I worked with back pain, and you can see that their stomach is protruding out a bit and their low back is significantly arched. It's what we call a lordotic posture. Her pain was not solved by doing any core work. Instead, it was resolved by fixing the biomechanical issues and movement patterns that were contributing to her back pain. So if you look at that image side by side with this other illustration of what I'm talking about, you can see that if the front of the thigh muscles are tight, they tend to pull the pelvis forward, creating excessive lordosis in the lumbar spine, and that also causes the stomach to protrude more. Core strengthening is not going to resolve the tight thigh muscle issue that's contributing to the anterior pelvic tilt, causing the excessive lordosis, which is at the root of this person's pain. Instead, we need to resolve the tight thigh muscles and the reasons that those tight thigh muscles are tight in the first place. This is generally how I work with most people. Here's another picture of someone, and you can see a left crease in their waist. And if you look closely, you'll see that one side, that the side the crease exists on, the pelvis is higher on that side than the other side. What you might not be able to see is that their rib cage is lower on that same side than the other side. This is what I call a side bending problem. And this person, as you might imagine, had unilateral back pain and beginnings of sciatic pain. And solving their problem had nothing to do with their core. It had everything to do with how they were using their body that created that elevated pelvis on the one side and the depressed rib cage on the other. If you think about it like this, if you have a big boulder that you're trying to move and you try and lift that boulder with your hands, it's a lot harder to lift or move that boulder with your hands than if you had a lever that you could just simply push down on to move that boulder. Well, what I have found in treating more chronic pain cases is that we need to address the levers that are acting on the spine rather than the muscles and structures directly around the spine like the core. So this is how I have found success treating chronic problems. And this is very different than how I was trained in physical therapy school. Many of you with back pain might be finding that all of your treatments are centered around core strengthening, lumbar paraspinal strengthening, dry needling around the lumbar spine, massage around the lumbar spine, psoas massage, all sorts of things like that. All of those are in the direct vicinity of the spine, and even though they may help relieve pain, they are not the reasons that you're likely in pain in the first place. Those reasons have more to do with how you're using your body and the lever arms that you've created that are acting on your pelvis and spine. If core strength were the end-all be-all in terms of solving back pain, you would never see anyone with a six-pack ever having back pain. But I can guarantee you that lots of people with six-packs have back pain, sciatic pain, SI joint pain, and you can't tell me that their core is not strong enough. What we're really talking about is core performance rather than core strength. And this is another misunderstanding in rehabilitation. I'm going to pause here right now and ask you to please like, subscribe, and share this video with others who might have pain, because you might be able to help them out. Thank you. All right, so what's the difference between core strength and core performance? Well, like I was alluding to earlier, you can be able to do 1,000 sit-ups and still have back pain. You can have the strongest obliques, you can have the strongest transversus abdominis, you can have the strongest rectus abdominis, but still have back pain. Well, why could that be if core strength was a primary feature in solving back pain or sciatic pain or other types of pain? Then people who lift weights, people who are athletes, shouldn't have any back pain at all. But we know that that's not the case. What we may be thinking about instead is core performance. And so core performance, in my opinion, is the ability to recruit the core musculature when it's needed. It's not so much a function of strength, it's more a function of neural recruitment, whether your brain is actually turning on the muscles at the right time or not. And even with core performance, I rarely focus even on that unless I'm dealing with acute disc issues. Those people seem to benefit from core performance, and I can go into those details later in another video, but acute disc issues require a little bit better core performance to help stabilize the spine for the discs. Again, I'm talking more about chronic back pain though, or chronic sciatic pain. So in all of the YouTube videos out there and websites and so forth that keep pounding on core strength as a necessity, I mean, I see it on TV all the time, and it's hard to look up anything about back pain without seeing someone having something about core strength. Really, I don't believe that core strength is the issue. And you've probably found this too. If you have chronic back pain, you've probably found, well, gosh, I feel like I've done everything my therapist has told me to do about my core and my back still hurts. What I have found early in my career is that it just doesn't help a lot with chronic back pain issues. And this is why I've learned that really it's about addressing how people are using their body and removing the lever arms, such as those tight thigh muscles I mentioned earlier, from the system, which then relieves the strain to the back. So this isn't to say that if you've been doing core strengthening or so forth that you should just throw it out the door. I mean, I think core strengthening is good to have. It's always good to have overall strength in your body for those times that you need it. But in terms of what is actually going to fix back or sciatic pain, I don't believe that core strengthening is a primary, even a secondary component of solving those issues. I have other videos that talk about this, for instance, this one about back pain, and then I have made this one about sciatic pain. Here's another one about leg length discrepancies, because a lot of people are told that they have leg length discrepancies. So I believe that there's a lot of misunderstanding of what's going on with the body out there. And I wanted to make this video to help those of you who have been struggling with your back pain or sciatic pain and have been doing all the core strengthening in the world and it's not helping at all. Well, this is why. Because it's not really changing the lever arms, acting on your pelvis and spine. I hope this gives you hope, and it would encourage you to please explore my other videos. I've put a lot of information out there about the different lever arms that are acting on spines that have solved a lot of chronic pain for my patients in the past.